If you get Botox kind of in and around your eyelid here, so around for like crow's feet and stuff like that, sometimes what that can do is actually cause your eye muscles to not blink fully. So again, that impartial blinking, you have to actually bring both of your eyelids together to squeeze, yes, just like that, to create the tears.
We're squeezing our eyes right now,
yes.
Really doing a solid blink.
Yes.
Everyone can join us. From CareCredit, it's Care Experts, a podcast where we dive deep into the health and wellness industry with the professionals that make it happen. I'm Erin Treloar. Dry eye is one of the most common eye conditions affecting millions of people worldwide. But it's more than just your eyes feeling dry. Today, Dr. Jenn Chinn, an optometrist and glaucoma-certified optometric physician, explains what causes dry eye, how to recognize the symptoms, and what you can do to find relief. Dr. Chinn, welcome to the Care Experts podcast.
Thank you for having me.
If you have ever had dry eye, have you had dry eye before?
Oh, absolutely.
Okay.
Yes.
It is so irritating and
is.
uncomfortable. And it makes it so difficult to focus on anything else. What is causing dry eye?
So dry eye is actually a multifactorial condition. So there's a lot of different factors that affect it, but there's two basic kind of reasons why dry eye disease occurs. One is you're not producing the good amount of quantity of tears, or it's that you're not producing good quality tears. So some patients can have both, or they'll kind of lean more towards one or the other, but that's basically it. So when you have one of those break down, you have this lack of like equilibrium so that you aren't coating and covering the front surface of the eye well. So then there's a lot of irritation.
What makes up a good quality tear?
So the tear film is actually kind of divided into different parts. It's not just water. There's actually like an oil portion, a mucus portion. So you have to kind of have all of those portions in the right concentrations in order to have a really healthy tear. And again, there's a lot of factors that can affect that. So definitely keeping that in mind in regards to how you blink, the products you put around your eyes are really important. What you potentially put in your eyes in regards to eye drops is also important as well.
You just mentioned a couple causes of dry eye, makeup, what you're putting on your eye. Can you go into a little bit more detail about that? What are the most common triggers of dry eye?
Yeah, the most common triggers are potentially putting makeup in and around your eyes, especially the biggest trend that we see that's really bad online is doing tight lining. So when you put that like eyeliner directly on the waterline, the reason why we call it the waterline is because that's where your tears come out, right? So what you're doing is you're actually directly clogging all of the little tiny pores. And that is obviously the makeup is getting in there. Those chemicals in the makeup or ingredients are getting in there. So that's really harmful for your eyes. And secondarily, related to makeup is not removing your makeup at night or not removing it well. So I always recommend going to see your eye doctor. They're going to have safe and healthy recommendations for you to remove your makeup safely.
Okay, when we're removing our makeup, are there certain products that we should use or should avoid to help support or reduce dry eye?
Yeah, so removing makeup, I mean, just wearing makeup in general, like I never recommend anything like waterproof. Waterproof is going to be much harder to remove. So typically like eyeliner and mascara are oil-based products. So you have to kind of use an oil-based product to remove it because oil and water don't mix. So if you try to use just water, it's really hard to remove. You have to rub your eyes really hard. Definitely keeping that in mind.
So for men who are listening right now, would you also be recommending using an oil-based cleanser for around the eye area?
It depends on how their eyelids and eyelashes look. So there's a few different products that, typically eye doctors will recommend for the patients, but we always recommend using something to kind of clean the eyelids and eyelashes. Typically it's going to be something with tea tree, especially if you have the eyelid mites, you have a buildup of that. But again, the reason why is because your eyelashes are not there to look pretty, unfortunately. They're there to like serve as, a mechanism to protect your eyes, right? So they're there to kind of catch debris throughout the day, and that debris builds up. So again, even if you're somebody that doesn't wear makeup, that debris is going to build up all the time. And if you don't clean it away, it's kind of like what we consider plaque. So that will build up, cause inflammation. And eventually that's why some people wake up, they're like, how come I have so many eye boogers and crusties in the morning? I'm like, it's because all the kind of eyelid junk that built up throughout throughout the day that you didn't clean before you went to bed at night.
Wait, is that all that is?
So some of that, and also some other mucus buildup, some tear buildup. Yes. So it's a lot of different things, but definitely it kind of all adds up together to create this kind of cycle of irritation and all of the nasty symptoms dry eyes can cause.
Okay, we are washing our eyes. Would you prefer for people to use clean hands, fingertips, or an actual washcloth or one of those little cotton pads?
You can use either the cotton pads or your clean hands. Just make sure, like, if you're using your clean hands, to not touch, any of the applicators of the products that you're using to it. So making sure you're being mindful of kind of contamination.
Okay, and we are doing this gently, everyone. Yes. You are not rubbing and scrubbing your eyes.
Yes.
The skin around your eyes is like tissue paper. It's really, we want to be gentle with it and kind to it.
Absolutely.
And not pushing in on our eyeball either.
Yes.
Okay, amazing. Would you say that people who are wearing glasses or contacts are more prone to dry eye?
Patients that are wearing contact lenses are more prone to dry eye because you're putting something in your eye and that can impede the natural lubrication of your eye. So there's something that causes a little bit of a barrier. So when you blink and produce tears, it's not going to evenly coat the front surface of the eye as it would without the contact lens, right? Yes. But luckily, a lot of the manufacturers these days, they are always updating their technology, doing a lot of R&D to establish better materials and better lenses for us that are more comfortable. So if you ever experience dryness, or especially at the end of the day, you kind of blink and you can tell that you're wearing contacts, that's not a normal sensation. Go to your eye doctor and ask them. There might be better solutions for you in regards to comfortable wear for contacts. But yeah, in the long run, can contacts definitely cause more dryness? Absolutely.
Okay. And can sunglasses protect us against dry eyes or not really?
So I would say it depends on the environment. So one thing that is a trigger for some patients with dry eye disease is light sensitivity. So when the light hits their eyes, because of how sensitive they are, they kind of start tearing immediately, or they kind of squint their eyes. So sunglasses can help with that. But when you have any type of eyewear in front of your eyes, if you're outdoors, it can provide a little bit of a barrier. So you're still going to have air kind of coming in around your eyes, but it helps from any potential wind coming directly to your eyes.
What about using devices, being on your phone for extended periods of time? How does that impact dry eye?
So we've actually done studies and we blink 60% less when we're staring at a digital device. So imagine if you're on the computer for 8 hours a day, you're only blinking 40% of the time the entire day. So you're only receiving 40% of that hydration or lubrication that you should be receiving. So staring at digital devices is definitely a huge factor nowadays. And I talk about this with my patients all the time, even from childhood age to adulthood, because children are now on devices all the time. It's a requirement for a lot of schools for kids to be on iPads now. So making sure to be mindful of taking breaks is super important. And of course, drinking water, using lubricating drops to kind of mitigate some of the potential symptoms of those tears evaporating and you just not blinking enough.
I can't help but think that the fact that we're on devices, blinking 40% less, that would have short-term impacts like things like dry eye or irritation, but that it would potentially really impact the long-term health of our eyes. What are some ways that we can protect our eyes, not only from dry eyes, but also ensuring that we're, blinking enough, getting proper lubrication?
Yeah, that's a great question. And it's something that I think we all struggle with. And even me as an optometrist, I struggle with too. I tell patients about this every day, but taking breaks and making sure that you're being mindful of just the routine and habits that you're building for yourself, right? So even thinking about with your iPhone, it'll tell you on a Sunday, what was your screen time throughout the week, right? So those habits of okay, I need to put my phone down a little bit more. Let me live life outside of on my device, and being just aware and conscious of, let me take those, mindful breaks. Let me drink a little bit more water. Let me use lubricating drops. Let me actually blink my eyes together. A lot of people tend to do partial blinks too, so they're not actually touching their two eyelids together. But there's a lot of different habits and behaviors that we can kind of alter and change that'll help our eyes in the long run, but it's all about staying consistent. So you have to be really good about this is going to be part of my new routine now, kind of I have a 10-step skincare routine.
Yes.
This is part of my routine. Every 20 minutes, I'm going to take a break from staring at a screen. I'm going to drink water. I'm going to use lubricating drops. I'm going to clean the makeup off my eyes. There's a lot of different things that we can do.
Beautiful. How do you know if you have dry eyes or just a general eye irritation?
That's also a really good question. So general eye irritation will have a lot of symptoms that are very similar to dry eye. So maybe it's like stinging, grittiness, just like itchiness, or you want to rub your eye, sometimes redness. But typically if it's just general eye irritation, it'll tend to go away once the irritant is gone. So let's say if it's like allergies that are causing that, or if it's digital device use, if you stop using the digital devices, then maybe your eyes will feel a little bit more comfortable. So those things will tend to subside, those symptoms. But generally when you have dry eye disease, because it's chronic and progressive, it typically, those symptoms won't get any better and they'll typically worsen over time.
Okay. Are there any links to things like Botox that could be impacting our eye health or affecting dry eye?
If you get Botox kind of in and around your eyelid here, so around for like crow's feet and stuff like that, you just have to be really careful, because sometimes what that can do is actually cause your eye muscles to not blink fully. So again, that impartial blinking, you have to actually bring both of your eyelids together to squeeze, yes, just like that, to create the tears.
We're squeezing our eyes right now, really doing a solid blink. Everyone can join us.
Absolutely. When you do that, actually, if you squeeze, like sometimes I can actually feel the tears building up around my eyes. It starts to feel a little wet. So again, you have to do the full blink. So people that potentially get Botox, they may not be able to fully close their eyelids. So then they start noticing like, how come my eyes are a little bit more gritty? They look a little bit more red. Then they'll try to use like eye whitening eye drops, and then they're just not feeling any comfort. So again, just being really mindful of not doing it too much, and also being very careful around that area because of that.
Okay, so if you have some irritation in your eyes, maybe they're feeling a little bit dry or gritty, how long would you wait before going to an optometrist in order to determine if it's dry eye or just something that's going to pass?
Yeah, so if you have something like grittiness or just an overall like irritation, typically most people go online and try to find remedies for it. So you can find online remedies, right? So like over-the-counter lubricating drops, preservative-free artificial tears, try to use those first. And if you start using them and then it starts getting better, fantastic. That just means that your eyes just needed some extra hydration. If it's like you're using the eye drops after maybe a week or two and it's still not getting any better, your symptoms are just consistent throughout the day, that's also something to keep in mind. So kind of keeping a tab of when throughout the day those symptoms are worse, that's also, something to be mindful of in regards to that too.
Okay, amazing. If somebody has dry eye and you're seeing them as the optometrist, how can you diagnose that? How do you determine? Like, what are you looking for?
So I'm looking for quite a few things. So one would be, of course, blinking, right? So that impartial blink, I'll look under the microscope as we're just chatting and I'm looking at the curvature of the front surface of their eye. I just watch how they naturally blink. And again, tons of people do impartial blinks. I also look at the quality of their tears, how fast they evaporate. I look at their inflammation around their eyelids and eyelashes and how healthy and clean their eyelids and eyelashes are. So there's a lot of different tests that we can do to kind of assess overall eye health on the front surface to ensure whether you're producing the right amount of tears for yourself.
Is there anything that we can be doing holistically to support our eye health if you're somebody who has dry eyes? You mentioned making sure that you're drinking enough water. Is there anything to say like that sleeping on your stomach could be harmful or any lifestyle factors involved?
Yes, there's tons of lifestyle factors. So we said like digital device use. So being mindful of taking those breaks. A big one also, especially in California, is like when it gets hot out, people are using ACs or they have overhead fans. So overhead fan is one of the biggest ones that air is being pushed directly onto your face. Not only is that, but there's potentially dust and debris being kind of like flown around. So being mindful of that too is really, really important. So making sure that you don't sleep with an overhead fan, and then also like cleaning your eyelids and eyelashes, making sure you drink enough water. And then there's also a lot of research being done in regards to diet. So diet is also a big thing that affects your overall inflammation in your body, and inflammation is something that can affect your eyes as well.
Okay. Anything off the top of your head that you would recommend for people to consume or watch out for when we're looking at inflammation in the body?
It really depends on the patient. So I always recommend that they go to their doctor and kind of discuss those things. If they have any underlying conditions, they already may need to do like an elimination diet or look at the FODMAP, look at any of those things with their doctor.
Amazing. Can age or hormones play a role at all in dry eyes?
Absolutely. So for women, especially, unfortunately, we get the short end of the stick all the time. So we tend to have a lot more hormonal shifts than men do. But as we age, our tear production just declines in general. So with women, hormones can also decline that tear production as well, or decrease the good quality tears that we're producing. So keeping that in mind is also really important. So a lot of women that go through menopause, they tend to notice that their eyes start to get more uncomfortable and more irritated.
I have some questions for our Ask Me Anything portion of the conversation. I've been using prescription drops for my dry eye for years now. Will this have any long-term effects on my eyes?
That's a great question. So as of right now, there haven't been any studies to indicate that there are any potential harmful effects as long as you're using the prescription eye drops as directed by your doctor. But just like any long-term medication, your doctor is going to continue to monitor you to ensure that that treatment mode is going to be effective for you. Because maybe down the line, maybe 2 years later, it's not the most effective thing. We have a different root cause that we need to fix. So let's switch to something else. Or maybe there's a newer medication that's more effective. So again, always make sure to consult with your eye doctor and make sure to go in for those follow-ups. There's a reason why they schedule them, is because if you have a long-term condition that's chronic and progressive like dry eye, they want to continue to monitor you over time.
Wait, dry eye is chronic and progressive?
Yes, it is.
Tell me more.
So it is a chronic and progressive condition. So it never really goes away just because we don't really stop using our eyes. We don't stop staring at things. We don't stop potentially using makeup or wearing contact lenses. So it will tend to get worse over time because we continue to have that wear and tear on our eyes, and we tend to have those progressive changes.
But if we made those lifestyle changes,
it can slow down. It can cause our symptoms to lessen a little bit, but it doesn't potentially, if you have dry eye disease, it doesn't make it cured.
Oh, interesting.
Yeah.
You just even said dry eye disease. So this is not just, this is beyond eye irritation at this point.
Yes.
I think that's really important for people to know, and hopefully also a bit more motivating and inspiring to stay on top of our eye health.
Absolutely.
Early on. The last question, my eyes feel itchy and scratch. Could this be dry eyes or allergies?
It could be both. The symptoms are very similar. But again, with allergies, it will tend to flare up during allergy season. So most people that have allergies, they kind of know certain times of the year are going to be more irritating for them than not. So you'll notice a lot of, watery eyes, red, itchy, and kind of just irritated and gritty. So if those symptoms subside after allergy season is over, then it's probably allergy related. But sometimes those two things go hand in hand just because of the inflammation and irritation that it causes.
Okay. We've talked about what to do if you feel you might have dry eyes, but I also want to just back things up for a second. Now that we are clear on the fact that this is a chronic disease that can progress, how do we prevent dry eye? What are the things that we can be doing today in order to ensure this isn't something that we struggle with tomorrow?
Yeah, so you can go into your eye doctor to discuss all of the recommendations that they have. They'll also, again, assess everything from the curvature of the front surface of your eye, your eyelids and eyelashes, to assess what is the root cause of the potential symptoms, or even if you're asymptomatic, what's causing it for you. But some of the things we mentioned before, like taking breaks from screens, using lubricating drops, kind of reinforcing those behaviors of being mindful of having a healthy lifestyle of, just too much of one thing is bad, right?
Yes.
So take
Moderation.
breaks from the screen. Yes. And of course, cleaning the eyelids and eyelashes, making sure that you can also add things like omega-3s to your diet as well on your supplementation. So those are some things that you can keep in mind also.
It's amazing. The more of these conversations that I have, the more you understand that's what is good for one part of your body, whether it's your eyes or your mental health or your gut health, often overlaps with what is beneficial in so many different areas of our overall wellness. So thank you so much for all of these beautiful reminders to look after ourselves, to take those breaks from devices, to spend time outdoors, to give ourselves a little sunlight and sunglasses in moments to fuel our body well. I really appreciate it.
Absolutely. Thank you so much for having me.
Hey there, don't leave yet. Just wanted to say, if you want to hear more about health and wellness, check out these episodes of Care Experts. Also, before you go, make sure you like and subscribe. New episodes drop every Wednesday.